Hi, extremely good morning, everyone. We are on the last week of the financial year closing. It's 28th of March, 2026, and we are here for a very, very important topic. I think this topic is a need of an hour for a lot of men, women who are losing their hair every day. So we are inviting you for regeneration medicine in hair growth. And we have with us Dr. Avinash Agrawal. Uh, Dr. Avinash Agrawal, MS General Surgeon, is a leading hair transplant surgeon and director at Acube Aesthetic Clinic, Ville Parle East. He is also the chief consultant at Hair Restore Clinic, Bandra in Mumbai, and is associated with Quest Wellness Mumbai, with distinguished and experienced in is in advanced hair restoration technique. He brings deep insight into regeneration approach for hair growth. I would like to open this session for general public. Whoever is watching us live, they can come here and ask questions in the chat box. Our meeting ID in Zoom is 818-859-11572. I will repeat that, 818-859-11572. And sir, I welcome you on CMAAO International Board, and we would be delighted to hear what you have to present us and give us insightful knowledge.
Thank you so much. Thank you so much for this beautiful opportunity today. I want to introduce myself, Dr. Avinash Agrawal, hair restoration specialist for over 19 years. It's almost covering 2 decades of a good set of work that we've done with more than 5,000 operations all over India International. And looking forward to, of course, giving the world the insight of how regenerative medicine, which I started in 2012 with PRP injections, which took turn to growth factor injections, and of course, our own patented cyclical therapy with nutrition and meso cocktails, which I will enlighten everybody with and show you some results as well. So taking this forward, the regenerative medicine for hair regrowth, definitely I think people here are aware that how hair regrowth is definitely very important for patients who already had issues, hair loss, hair thinning, hair volume that is going away. And that could be also related to your androgenetic alopecia, sometimes like a patchy alopecia, which is also called as areata patch, infection, which is in folliculitis or lice infestation. All this can cause a lot of hair loss and hair thinning. With fungal infection, dandruff, psoriasis, patches, or premature graying also can make the hair go thin. Now, in androgenetic alopecia, typically where with genes are concerned, we definitely try to balance the diet, the food, the eating patterns, the environment, whatever we can get in control with. But of course, not everything is under our control. So we need to really give them the right nutrition for their system so that the hair can usher back and grow the way they should, which is also supported by cyclical nutritive therapy. Of course, minoxidil happens to be the mainstay, which is, of course, the US FDA approved with finasteride. If required, as a tablet for a DHT inhibition, that is dihydrotestosterone, which is to be reduced in the body. Cannot be completely eliminated, though. Yes, mesotherapy, which is microneedling, or even taking nutrition into the scalp skin through electroporation or ionophoresis. Platelet-rich plasmas, exosomes, and peptide injections, which is in today's times I'm going to talk about, is very, very important, and it can really change life completely. But before which I would like to enlighten what can a general public really do is use nutrition, use tablets, use applications that can really enlighten their hair and make the hair quality much better. Low light laser therapy is also talked about, which is phenomenal. A cold beam of laser that can penetrate the scalp skin at a frequency of 650 nanometers can easily make the follicles revive back because of the activation of the adenosine triphosphate molecule from your own mitochondria in the cells. This can make the exchange of fluids from outside to within and from within outside, which is taking the toxins away. And hence, it can really enhance your growth. But of course, it is like a stacking effect. It needs a lot of patience and time for which the hair results start to show. Of course, those who don't have the time and the energy and the patience and have lost their follicles completely, which your doctors can diagnose. The doctor will tell you exactly where your follicles are completely dead and gone. The skin is smooth and shiny. You need to replace hair by putting some grafts from the back of the donor area of your scalp or donor area from the body, which can really create a new hairline of filling in the gaps of spaces and hence give you more voluminous appearance, either by an FUT surgery, that is strip transfer surgery, where you take in a strip of skin and dissect into follicular units, or you take follicular unit extractions by a circular punch and remove these grafts and take them and plant them in the front so that they can grow as natural hairline. Looking at different treatment options that are available for AGA, that is androgenetic alopecia. So you need to really find out this by a hair pull test. If you see by pulling the hair, 3 to 4 attempts, maybe about 4 to 5 hair being pulled out, it is a positive thing. That means there's an active loss happening. And there's also a static, that is a slow progressive growth that can happen, that you typically see as waking up in the morning, hair on the pillow, or taking a shower and hair on your towel. That is something where you understand that the hair is falling very slowly and progressively. And more than 30% of the hair lost, where the hair becomes very thin, and you go baby-like. And also people who have more than 50% hair area which is lost and divide, which is smooth and shiny. Yes, we can do is hair transplant. How do you control the hair losses? So first find out how much is the loss. Is the loss a point of no return? You need to actually assess the hair quality, the thickness, do a trichoscopy examination, find out the number of hair that are falling every day, if they can actually sit and count, if that's possible, which is really difficult though. But up to 100 hair for men is normal and up to 50 hair for a woman is normal. But every decade of life, you will see 10% reduction in the hair volume, which is normal again. So if a person who's 80 years old would have lost 70% of its own existing hair, but still have left with 30%, which shows a good cover, that still is okay for them, as age and senescence can catch up with everyone. What are the main active ingredients that typically used for the active phase of the growth of hair? To bring back the hair in the active growing phase, which is called as the anagen growing phase, is minoxidil solution, which could be alcohol-based or non-alcohol-based, lipid-derived based or aloe vera-based, with the percentage from 2 to 5, maximum 12.5% available. There is redensil as a molecule, which is 1, 3, and 5, capaxil, adenosine, caffeine, procapil. Lots of biomimetic peptides, which are also available as bioactives, which could be not just from natural Indian herbs, that is concluding Brahmi, that can help you bring the size of the follicles become more thicker in the anagen growing phase, prolonging the anagen growing phase. Bringraj, which also helps you grow factors that can be increased, that is the TGF beta-1 expression in the anagen growing phase is increased. The exogenous mediators that stimulate the follicular keratinocytes proliferation and delays the terminal differentiation by down-regulating the TGF beta expressions. Ginger, which also is very important, that is an essential fatty acid like the linoleic acid contained in ginger, prevents the hair fall and hair thinning. It is also acting as an antiseptic and antimicrobial properties, controlling the dandruff, soothing the scalp, and prevent itching in the scalp and scratching, so that you don't destroy the cuticle at the base. Muletti, which is one of the, again, licorice as a part, helps you in inhibition of the DHT or the 5-alpha reductase activities that is happening. Tulsi helps you as like a herb, which brings in the receptors and makes the chemical composition of the blood reach to a certain level. Chamomile, which is also like a relaxing agent, can help as an anti-androgen properties. Mint, which can easily promote the conservation of vascularity to increase more blood vessels to the dermal papillae and hence increase the anagen growing phase. Rosemary, which is also very, very popularly known, people also apply this regularly, help you reduce the 5-alpha reductase activities on the scalp skin, and hence in androgenetic alopecia, it's very beneficial. Talking of neem, again, antifungal properties, antibacterial properties, pain relieving, and these compounds help also treat dandruff. Herbs, which are also available, called as root reveta, improve the blood flow and has also prevents the premature hair fall. Talking of the basic ingredients that one should really look at for today's time is redensil, a very good ingredient that can increase the volume of the hair, make the hair quality thicker, acts as an anti-inflammatory agent, is an amino acid builder. These ingredients also are made up by DHQG, EGCG2, glycine, zinc chloride, metabisulfate, glycerin, and water as a combination. All these products are molecules extracted from different plant source, and hence redensil is one of the most ingredient looked after in comparison to minoxidil. Can that really replace minoxidil? We don't know that, but definitely it cannot do at this moment. We definitely need to combine this with minoxidil as well. Maybe a daily application of redensil in the morning and an application of minoxidil at night can really make a big difference in the growth of the hair. Talking of different ingredients, why redensil ingredients help? These are polyphenols, which are actually activates the division of hair cells. It also helps in maintaining the differentiation and properties of the stem cells from the apoptosis. It is helping the beta-catenin activation. The EGG glucoside also is derivative of a typical inflammatory state of alopecia scalp. And that's why the reduction of interleukin-8 and the capturing of the free radicals that can easily happen. Glycine is like a hair protein, maintains the keratin and makes the KAP, that is the keratin associate proteins, favor the hair growth. Zinc is a cofactor, which is like a numerous enzymes that are available, help in the transferring of the nutrients from the cells, that is helping incorporation of the cysteine and keratin for making the hair shaft stronger. Now, talking of CAPXL, CAPXL is also a breakthrough treatment for men. It is typically helps in penetrating into the scalp roots by promoting the growth of the follicles, reducing the inflammation. It is used majorly for men and women, typically for hormonal imbalances, also believed to have a magic potion-like effect with thinning and makes the hair lustrous and luscious. Also, the biomimetic peptide that I talked about, like CAPXL, it is made from the ingredients like the red clover extract and acetyl tetrapeptide. The red clover extract is a plant extract which is taken from the red clover leaf. These extract is usually used for postmenopausal women, which was studied in the past, and hence it has shown that this can grow hair. It also has abundance of biochenin A, isoflavonoids, and these are photoestrogenic effect, and they make the hair quality more growth and thicker. Acetyl tetrapeptide, by the way, is like a hair follicle stimulator. It's got extracellular matrix in which it is surrounded around that. And this acetyl tetrapeptide, as I said, ATP is also required for the promoting of the cells to make the way for good food to get in and out the toxins. Talking of procapil again is a combination of epigenin, olenic acid, which is extract from the olive tree extracts. Now, these are helping increase microcirculation, follicular aging, cell atrophy can be reduced. Also reduces the dihydrotestosterone levels in the skin, and also used typically for patients who have very sensitive skin and even in men. So it is a combination treatment that is now available with minoxidil. Most of the minoxidil preparation does have procapil, and hence the ingredients which are mainly the biotinyl, GHK, epigenin, and oleic acid, which are definitely making the cell, the scalp getting more better in the quality of the hair. Adenosine 1% is also very beneficial as it helps in the phytocell tech Malus domestica reduction. Niacinamide, which is also a part of adenosine, makes the follicles grow better because the pores are being opened and they allow the follicles to have the blood supply getting increased, and the reducing the oxidative stress level because of aging and senescence as well. And different amino acids like taurine, hydrolyzed collagen, glycine, cysteine, niacinamide, all these are very important so that when these are also vehicles typically helping the follicle, the medicine penetrate the scalp skin, which is the propylene glycol, the methylparabene. All these are definitely helping the follicles get the right amount of amino acids. Talking of chrysanthemum, which is also an Indian herb, again, which is extracted from watercress. This is a plant and a leaf, which is, and this is the plant glycerin, which is available. It makes the hair follicles more smoother, more shinier, and the luster is returned back. Of course, it is a path in which the well-structured hair follicles are regenerated by the Wnt pathway, which is the most important pathway in most of the hair fall cycles. Anagen is a part again of a pea root extract, pea sprout extract. Now, pea sprouts are well known again, which is a protein that can be taken as nutrition. And these are not just active ingredients to prevent the hair from falling, but even premature graying, premature fall is also prevented by these amino acids. So anagen typically is added in most of the shampoos, conditioners, serums, and hence this is a very good ingredient to make this hair grow better. Talking of L-arginine, biochenin, acetyl tetrapeptide, which is definitely spoken about, all this act at a cellular level and make the hair follicles go better. Talking of L-arginine, it is a body's nitric oxide production, typically also taken by gym trainers to make their cells go better so that they can have a better pump and a push. Also, people want to reduce weight. Talking of L-carnitine and L-arginine, it is a combination treatment given, makes the follicles grow better. Also, you've noticed that people who lose a lot of weight can lose hair as well. And this is where the pathway is really enhanced. Otherwise, if they don't have that kind of nutrition, they will definitely lose a lot of hair. So biochenin again reverses hair thinning, reduces the phylyl reductase enzyme activity, modulates the DHT formation. Also, acetyl tetrapeptide stimulates the extracellular membrane of the protein synthesis. It helps in collagen and laminin synthesis. Talking of oxina, trichogena, a very new ingredient and a product which is available in very few products in India, where there is only one company who manufactures it. and brings it to India, which is called Adroid. And of course, talking of how it affects is it stimulates the physiological hair growth. So there is no hyperemic effect. It does not produce scalp hyperseboric effect, reduces the greasing of the scalp. Hence, it is effective as ethanol. It's an anti-hair loss product used in hair mask, eyelashes, brows, also in growth serums and beard. It can be used. So Oxina typically is a mixture of hydroalcoholic extracts from 3 species, which is the Farfara, Achille folium. Of course, you can read them. These are different names, which are the alkaloids that are available, and hence these actually, when combinations, can make the hair go better. Talking of emu oil, everybody knows about the emu bird, which is the fat of the bird can be used. It has got a natural antioxidant effect, like carotenoids and polyunsaturated fats. Also replaces hair follicles, replenishes the hair follicles. By using this vitamin, you can make the hair quality much better. So it is an anti-inflammatory as well as grows good quality hair, and it even stimulates the DNA synthesis up to 20%. Melatonin is also a relaxant. People today do not have good sleep, so they need the right kind of sleep. Where serotonin is also a required product, which is a byproduct of melatonin, and hence melatonin oils can be used on the scalp skin, which can penetrate the skin and still give you a very relaxing effect, plus help grow hair on application. That is, it helps in extending the anagen growth phase of the hair. Using of topical finasteride, topical dutasteride, and arachidonic acid, which is where it is most important today's time, because nobody wants to get in the post-finasteride syndrome, where tablets are given most of the time when patients really complain of other issues like erectile dysfunction, delayed ejaculation, or even low libido. So to avoid such situations, a topical application of finasteride, which when penetrated into the scalp skin, can equally work better, which is more than a 41% efficacious. As in comparison to the oral application, of course, it is 100% efficacious, but 41% is also significant efficacy, in which the application can make the scalp get better. So this is helping reduce the DHT, that is the 5-alpha reductase enzyme activity. This is a DHT inhibitor. Dutasteride, equally now in today's time, the talked about is injectable dutasteride. It can be given either with mesotherapy or direct injections. It is combined with the biclopramide, and this is a good combination which can be used typically for female pattern hair loss. Arachidonic acid again is helped increase the hair shaft elongation. So people who really say that my hair is not growing longer, they should have serums which will contain arachidonic acid. These are a few results of patients who got results with just the applications. We've not done major therapies in them, but just a local application of most of the patients. So these are a few patients. You can see how the hairline is also improved up to 1.5 centimeters. So treatment needs to be continued. You cannot stop any kind of management. All the thinning areas, patients with grade 2, 3, up to 3A or 3V, you can easily administer these applications. Even for patients who have lost hair, like the Ophiasis patients, or patients who have had psoriasis, seborrheic dermatitis, or even at the periphery when they lose a lot of hair like this, could be because of use of telephone, which is a radiation. So now the topical application that we know of is also in alopecia areata folica tincture, which contains benzoyl nicotinate, salicylic acid, vitamin K, and all this helps in increasing the oxygenation of the skin, and helps the salicylic acid also penetrates the scalp skin and makes the cells shed more faster, promoting new cell growth. So this is what we need typically in patients with alopecia areata. And of course, who doesn't know about the intralesional steroid injection, which can be given for alopecia areata patients, that can really work for them, because even for patients with long-standing history, 5 years, 6 years, they have not grown their hair back in the patch, can sometimes really see wonderful results. Talking of stem cells, which is definitely today's topic, which we really want to know, is regenerative medicine. Why is regenerative medicine talked so much is where you need to understand that where does the stem cells come from? And that's where the totipotent stem cells, the pluripotent stem cells, hemopoietic stem cells, these are mesenchymal cells which are available from the body from different parts. First stem cells that we always have is the umbilical cord stem cells. Then we have the stem cells which are derived from the teeth. There are stem cells which are available in the bone marrow. Also hair follicles, they are also like a stem cell. The base of the hair follicle is typically having a lot of endothelial germ cells, which will have the stem cells, and hence when injected can make the cells grow faster. Now, what we typically do in our clinical practices is first to stimulate the stem cells by using microneedles, or we also call this as a mesotherapy solution. This mesotherapy is nothing but creating micro injuries into the scalp skin. This is done either by a derma roller or a machine, which is also called as Dr. Pen. This is where multiple needles of 12 to 36 can be penetrated to the scalp skin at different speed to make the similar channels. And these channels allow the penetration of better ingredients which will grow the hair back, which is a biotin, copper peptide, fusitin, resveratrol, hyaluronic acid, and many other peptides, including vitamins A, E, D, K. Everything is very important. All these nutrients are penetrated into the scalp skin through the growth, and hence these cells can really grow back. The stem cells are activated, stimulated through different means by such, and they can be increased by, for men typically with 1.5 mm depth, which is again the depth of the needle that is penetrating the skin. That is either with a derma roller or derma pen. And in females, even up to 0.5 mm depth is sufficient enough to make the hair follicles grow better. Talking of different stem cells that are now available also is Doctors Major's platelet-rich plasma. These are nothing but injections. These injections can be given into the scalp skin. This is like a growth factor, which is prepared separately from outside the body. And these growth factors can be injected into the scalp skin. How do you do this? Is by taking the injections from the blood. And these blood cells typically have the platelets, they have the growth factors, and these platelets are made into high concentration, expecting is to be 8 to 10 times concentrated, but definitely 3 to 4 times concentrated platelets are still good. They can be injected as a buffy coat, which will activate in the skin and hence allow the cells to grow. To make these cells grow better, you have to inject them on a regular basis, because remember, every cell that is penetrated cannot provide the right growth factors to the cell immediately. So this will happen with time, and hence these growth factors, including the platelet-derived growth factors, the wedge endothelial growth factors, interleukin growth factors, the fibroblast growth factors, and hepatocellular growth factors. These are very important growth factors for the growth of hair. Of course, there are many more other growth factors I'm not talking of right now. But looking at the cell cycle, that how the hair grows is typically while activating the cells where the Wnt pathway has to be controlled. Now, when the hair cell starts to divide and multiply, and there's an action of the DHT, there's an action of different environmental factors which will make the cells go weak. So these growth factors come into a pathway where the signaling happens. The TGF beta factors, the growth factors, the fibroblast growth factors, all these factors will initiate the anagen growing phase of the hair, and the hair starts becoming thicker. Looking at these platelet-derived growth factors, what typically does is promotes the blood vessels, new formation of new blood vessels, cell growth, helps in tissue regeneration. So it's like a master switch to stimulate the dormant hair follicles. The endothelial growth factors increase the angiogenesis, which is new blood vessels that has to be grown into the scalp skin, ensuring proper nutrition is delivered to the scalp. Now, of course, as I said, the nutrition in the body has to be also optimum, and hence the nutritional cyclical therapy has to be provided. The insulin-like growth factor strengthens the hair shafts, increase the hair density, and maintains the hair follicle growth. This is like a fibroblast. Of course, the growth factors, fibroblast growth factors, especially the FG2 and FG10, that increase the hair follicle cells proliferation and increase the size of the follicle. So remember, the size of the follicle is very important to have a thicker hair that is going to grow. So you need these growth factors. Epidermal growth factors promotes the proliferation and regeneration of hair cells, and the hepatocyte growth factors enhance the proliferation of follicular epithelial cells. Talking of how inflammation really makes the difference, this is how the mesenchymal stem cells really work, where the inflammation reduces by the T lymphocyte activation. It also reduces the macrophage infiltration and the microglia activation, helps neurogenesis, apoptosis, trophic factors, that is secretion of neurotrophic androgenic factors, synaptogenesis, myelination, angiogenesis. So it is definitely making the cells and the blood vessels, the nerves, everything grow much better in the scalp, and hence stem cells really stimulate the follicles better. So types of follicles, we've just talked about embryonic stem cells, which is from the cord blood, mesenchymal stem cells, which is like from the bone marrow, adipose tissue, and hair follicles itself. Talking of newer generation therapy, heard of is called as Regenerative. It is a machine in which the follicles are actually taken from the scalp skin in a bundle of 3 or 4 hair together with a punch biopsy, and they are placed in a like a container, which you can see in the extreme right, and they are used in a machine at a particular speed, and hence these blades which are surrounded in that, it's containing 600 bleeds, that's what they say, can really divide the cells and make you available in the sale container. Of course, you mix it with saline and then you extract the whole content and inject back into the scalp skin every 6 months. to transfer some of the stem cells which are available at the hair follicle itself. Of course, if you don't want to go for some surgical procedure like this, you want to go more simple, you can use directly your own blood or bone marrow, which is directly taken from the ileal crest. Talking of stromal vascular fat, which is also a very known thing today's time, because people want to have the best of the adipose tissue stem cells which are available, and that could be taken from the fat which is available at the side. Your love handles, typically we can put it into a container and actually thaw the solution so hard that you can make a very liquid solution that is more than 100 times thinner as a fat, and this solution can be easily injected into the scalp skin in general, about keeping a centimeter apart, about 2.2 ml each, and maybe about 7 to 8 ml of these stem cells are injected into the whole scalp, and expecting that a good growth happens. Yes, it is one of the most finest technique, most well-known technique, because it's your own blood, your own stem cells, your own cells which are going to grow. But remember, stem cells have its own properties. It is not working for you since all these years that you've been trying, because your hair wants to grow, but some environmental factors, some genetic factors, some factors are always holding you back. And hence, even if these stem cells are not working, you have external available stem cells which can really work, because these are not just stem cells, these are exosomes which are available. So now I will talk about exosomes in a while, but just to show a few pictures of patients who already attained good results with just these injectables, which is using your PRP GFC injections. You can see how the growth comes back. It is a patient of alopecia areata. This is a patient with hairline. Of course, we have done a combination treatment with hair transplant. It's not just only transplant, but his own existing hair also grow back. So it's like a double effect, and hence you can see a lot of density. Similarly, patients with grade 7, you can do combination technique. Where I do usually is a combination of FUT and FUE. I take hair from the skin at the back, like a strip of skin, and hair above and below, which is the FUEs, and I combine to maybe make it about 7 to 8,000 grafts in a single session. This is a young guy with, again, a combination treatment, FUT, FUE. Plus, we have also done a lot of GFC injections in him. Almost 2 years of follow-up, as you can see what he has hair. But of course, his hairline is given a very youthful hairline to him. So hence the density is not very high. Again, a friend who's done a hairline transplant with just 2,500 grafts, looks decent. Got a temporal hub, which is the curve of the hair. And hence it looks really nice because it is really framing his face well. Looking at somebody who wants just to frame of his face, a hairline development, a temporal fixation can be done again with transplants. But remember, he's going to lose hair in the top of the scalp, the back of the scalp, and hence stem cell therapy is here to stay. Regenerative medicine will really make the hair grow back. That means the number of hair that is required by the patient requires a lot of hair. If you see on a scalp, typically you might have about 1 to 1.5 lakh hair. And what you lose is typically the frontal part of the head, which is up to 50,000 hair. But you do not get 50,000 hair to plant. What you get to plant is about 10,000, 15,000, maximum 25,000 hair in about a couple of sessions. But 20,000 hair strands will not mimic and look like a 50,000 hair strands always. So your existing hair are the first to grow. That's why regenerative medicine really helps to grow back your existing hair. And along with which, if you do a little transplant to fill up gaps and spaces, definitely. That's the way one wants to look at. That's the way one wants to have their hair filled in. Again, a model who comes for a hairline transplant, you can see here. We've done his hairline. 10 days after that, you can see that picture to the left. And of course, we've done hairline, and this is how it looks in the next. A young friend of mine lost a lot of hair, but of course, we did just about 2,000 grafts, filling in gaps and spaces. It's like transferring stem cells to the existing hair also. So transplant is not just what you say that is you do transplant, but of course, there is a stem cell transfer automatically happening at the base. And hence your existing hair also starts to become better. Again, a young boy with very little hair. Of course, the international standards typically say that up to 22 years is the minimum age for transplant. This is a 19-year-old boy. I've done him just because it's his life. And I think he needs to decide it very truly where his modeling career was affected. His hairline really didn't give him that kind of opportunities, and hence he was very upset of things. And I wanted to do him. Talking of a dear friend again who comes from Goa, has lost a lot of hair, looks very old and senior, got a very good hairline, but of course didn't wanted a hairline to look so mature or so youthful. And hence we took a very backstage, like, we took a hairline of a 35, 40-year-old gentleman, which will be maintained by him for a long time in life. He do not have to really worry that he needs to remove his hairline or remodel them. So of course, there are celebrities who've done transplant with us. This is a dear friend who's a chronic smoker, a kidney patient, and he's been really troubled always. His wife was always troubled, and he always wanted to look his best. Came to us, said that, can you get my hair shaded at least, if I could not look my age. He's 56 years old, by the way. And now at 63 also, he still has good hair. And the wife is very happy. They keep sending us their pictures whenever they are out somewhere, when they're showing their hair, and very glad to have them. So last I come to this topic of exosomes. A very well talked about information that people have is either, is exosomes good? Is exosomes bad? Exosomes can be injected. Are they supposed to be just put into the skin by mesotherapy? There are a lot of questions that are coming in today's time, and nobody is very sure, because what they see as results is still they are not very sure. It's been about 4 to 5 years where good practice of exosomes happening in India, and we are looking at as a non-surgical hair replacement therapy. Do not say that, because this is something which is going to be misguiding people. Of course, again, I said to you, it is the way that the stem cells help you grow back your existing hair, if you have the hair follicles live enough to be able to grow back. Now, talking of those live cell follicles, if you do a micro dissection of the scalp skin, the follicles which are very close to the skin and actually has lost the attachment to the recta pili muscle are the ones which will not grow. Only the ones which have some attachment, and those who can actually accept the stems, that is the cells which are the growth factors which are available from around the tissue, those cells will again go back to a good stage and increase the thickness of the hair, and hence the hair follicles survive back. So as we know, in regenerative medicine, stem cells are nothing but vesicles that will stimulate the dormant hair follicles. They are packed with growth factors, proteins, RNA. They help promote thicker, faster growth of androgenetic alopecia, especially in other conditions for hair thinning also. So it can be mixed as a combination with PRPs, it can be mixed with GFCs, it can be done alternately, can be done together also. Because most of the time, if you're doing a plant-based exosomes, you should not do a deep penetration of these cells, which should be just doing it with mesotherapy. Animal-derived or cord blood-derived definitely can be injected. But again, cord blood, only those people who have already left their cord bloods, and then they can get their own stem cells or exosomes prepared. But if that's not possible and they're using stem cells which are from otherwise, those stem cells or the exosomes which are available, they have to be very carefully injected, because they also carry signals or pathways in which there could be inhibitory effects or unwanted effects. So that's why the messenger RNA cannot be differentiated to the best capacity that the hair survival will be the best. So you need to be very careful while the signaling is happening. Else, most of the growth factors typically when given is either with micro injections or with micro needles, very superficially, and they're penetrating into the root area. Of course, this help in growth of the anagen growing phase, and the action is typically by angiogenesis, that is new blood vessels, and they reduces scalp inflammation as well. So talking of this beautiful technique and topic called as regenerative medicine, I rest my topic here, because definitely I think I can go on for ages together, because regenerative medicine is not stopping here. It is not just giving good growth for patients who want to have their teeth back, or people who have their joints as issues in orthopedic practice, or many such patients who really want to get their systems aligned, where even anti-aging or growth that is happening, where a whole transfer of your own plasma from your son is given to a father, or things like that, can actually make a different change in your system. So definitely talking of NAD plus, talking of MNM, talking of glutathione or injectables which are available today's times, right from BPC to GHQ to all these peptides which are injectables as well. All these have somewhere a relation to stem cells, and hence stem cells can really grow better to not just anti-aging, to reversal of aging, to grow back your hair, to really get to what you want to look like. Thank you so much once again.
So thank you so much, Dr. Avinash Agrawal. I think we can close the presentation so that we can come on the screen. I would like to now open the question answer round. People can come ahead and ask questions. So Dr. Avinash, just before we proceed, my simple question is, wherever people talk about transplant or medicine related to the hair regrowth, people talk about how safe it is, because this is something which is like more cosmetic. You know that there are artificial hairs which have been there. So people are a little scared of the pain which they go through with the hair transplant. People are very scared about the medicine, which is there any side effect or not. Would you like to throw some light on it?
Yeah, so hair transplant, by the way, it is just rearranging follicles from the areas which you have them to the areas which you don't have them. Now, these follicles can be made available either on the back of the scalp, which is the donor zone, a beard area, from the chest, from the underarms, private part. All these hair are made available to put into the scalp skin. And these are natural growing hair. They do not fall down very easily. They grow back and they live with you for many years, minimum 50 to 20 years. It has been studied like that. But again, yes, of course, when you're penetrating these hair, they're injected by special needles. And these needles need to be inserted into the skin, into the layers where the hair root actually lies. So for that, you need to anesthetize the scalp skin by local anesthesia. Now, the initial phase where the anesthesia is given is a little painful because, of course, you will have to wait till the anesthesia acts into it. It is about maybe about 7-8 pricks to the right, 7-8 pricks to the left. And once the scalp skin becomes numb, you can allow us maybe millions of injections. Typically, of course, not millions, it will be 5 to 7,000 injections that are given overall till the end of the procedure, because you're taking out hair, which is also like an injection. You're putting in hair, which is also like an injection. So these many injections are given to the scalp skin, but you feel nothing. So the beauty is your scalp is numb and the body is now in that healing process. It just started to fight back and become much better. So to heal the body will make different changes. So that's why pain is also part of a healing process. So to avoid that, we mask that pain by giving painkillers, which is an anti-inflammatory. We give diclofenac or aceclofenac, or sometimes we give ketorolac. All these are painkillers which will really not allow you to have the pain during the procedure, after the procedure, and up to 3 to 5 days is the medicine given to you so that you don't have the pain. Looking at the side effects, there are no side effects of surgery because this is your own natural skin which is going back into your own skin. Having done it right, if it's done wrongly, of course, there are a lot of side effects that can happen. There are a lot of complications that can happen. I don't discuss complications typically because I know we don't create complications, because when you learn certain process, you are very sure that this is how it's going to act and this is how it's going to make results. But if your process is only wrong, your method is only wrong, you can have a lot of complications and side effects. And that's where what is to be very careful, that who should do hair transplant, what you should see when selecting a hair transplant doctor, what kind of experience that the doctor should have, what cases he must have done, what number of cases he must have done to be the best so that he doesn't produce any complications further on you. You need to mute.
And what about the medicines? Are they lifelong or
Yes.
are they?
So when I talked about this question, I tell we live all throughout, right? 70, 80, 90 years. And when we live, we eat every day, we brush every day, we bath every day. And then, of course, if I get blood pressure, I take a BP medicine every day. So it's like a lifestyle problem that you've got. You've not got a disease. You're not sick. So hair loss is not sickness. Hair loss is a lifestyle disease or a problem which is equivalent to something like a blood pressure, diabetes, or patients who have already been on chronic diseases. So this problem doesn't go away from your system. It will be remaining controlled enough till your medicines are controlling. But the medicine effect is gone in few days' time, 6-8 months maximum. You will lose again because your genetics are active throughout. You can't change your genes. There've been stories where people have tried to get the gene out right when the baby is in the fetus, just when the two cells which is formed. They would rather take out that cell and the gene, destroy that gene, put it back. But while destroying that gene, the links are so strong that there are multiple other links also. That also got destroyed. And then the baby could not come. It did not grow only. So somewhere the genetic makeup that has to change. That will happen, of course, with long term, maybe in 30 years down the line. And of course, there will be cloning in another 10 years down the line. There will be a lot of new technologies that will help grow back hair in a much simpler way, much lighter way. Hence, regenerative medicine that we're talking of today.
Dr. Monica, you have to say something?
Dr. Agrawal, that was a fantastic presentation, and I think it's a presentation that affects everybody.
Can you repeat the question? It's not audible.
Oh, sorry. Let's see. Am I audible now?
Very little, but you can say.
Okay. I just wanted to say that your presentation was fantastic, and it is applicable to everybody, whether it is in our personal lives, whether it is in our social lives or our professional lives. The only thing that I wanted to bring up is the use of spironolactone. I know that that's available in India under the name of aldactone and Spirix. For those who are contemplating what the next step is and to give them a place to try something rapidly available, something that they can see whether or not while they're contemplating the next more surgical like intervention. A low dose might prove beneficial for female balding. And I just wanted to know what your experience or why people might have not decided to pursue this or felt that that was not effective for them to pursue the next
Yeah, so
step.
spironolactone or aldactone is a calcium channel blocker. It's like reducing your BP, blood pressure. Similarly is minoxidil, but minoxidil was always known to be taken as application. And hence it was not something that will reduce your blood pressure in a big way. So you apply the medicine and you go off to sleep. But aldactone is a medicine that you take orally. Now, when your blood pressure is something that is worried about, and especially in women, as you said, you give this medicine and they usually have a very low blood pressure. Women do not have a very high blood pressure. So they might feel lightheaded, they might feel uneasy about it. And hence it is very crucial to decide that when you want to start using aldactone on a patient, especially women, and definitely maybe anybody who's postmenopausal or those who have gone any hormonal therapies or people who have, women especially, who have had PCOD, I think they are good candidates for selecting as aldactone or spironolactone to be given. But of course, with a low dose to begin with, and then of course you can titrate and step up. But in my practice, I definitely would like to do more of regenerative medicine, which is the mesotherapy that I start immediately on a woman who comes to my clinic. I would not give them any oral therapies. Yes, but if they are very reluctant to start minoxidil or minoxidil boosters, because remember, minoxidil also doesn't work on everyone. You have to have the minoxidil sulfonyl urease enzyme. And if you do not have the enzyme, the minoxidil sulfate doesn't happen, and hence the reaction of minoxidil don't happen. So those women typically also who are either non-compliant or those who do not want to take the medicines application because it makes the hair sticky and dry and they are very, they look very low, I would give them an oral minoxidil. Now, even here, similarly, we need to check their liver status. We need to check their blood pressure regularly every 3 months. And hence, we need to titrate the medicine accordingly. Of course, 2.5 mg morning, evening is the maximum dose that I have given in my practice. But it's been safe and showed really good results. And unfortunately, a lot of side effects with a lot of facial hair and unwanted hair in different parts. But to talk about aldactone, yes, definitely, I have slowly, over the last 7 years roughly, have completely given on the practice of giving aldactone.
That's fantastic. I have one more comment. And also another way that people are addressing hair loss is through red light therapy. These are devices that people can get online. It's readily available to them. What is your experience on that?
Yeah, so I definitely believe photobiomodulation is one of the most finest way to get your hair going good. Recently, topics that we talked about where it is called as MCT, a machine in which you can actually activate your own platelets, growth factors with a certain amount of light, temperature, and hence allow the exosomes from your own platelets to start excreting into your plasma, which can be injected. Now, looking at that point, of course, photobiomodulation is the hot topic of today's times. And I've even given a lecture last year in the Macon, which was required. So that photobiomodulation in which your laser lights have to be at a particular frequency, which can penetrate the scalp skin at a particular depth, which is the 650 to 670 nanometers in frequency. That has to be guided. So those diodes which are available, they are quantified, they are made to the right depth and taken regularly, of course, which is 30 minutes every alternate days of 80 diodes. That can really help the hair grow better. And definitely in a long run, up to 6 to 8 months minimum, they start seeing the change. But if they don't, of course, we can increase and step up the dose to maybe making it twice a day for alternate days. But cannot give it every day because it is very, very high on the energy. And hence, I think 650 nanometers is a good dose, which will really make the hair grow better. So this is given for patients with regenerative medicine also. Like, when they come for the injections, like growth factors or PRP, we make them wait for half an hour before the PRP is getting activated or the growth factor is getting activated or they are centrifuge. So during that time also, we provide them with this low light laser therapy device. We make them wear this helmet, and that can really make the hair and the scalp more stimulated for the acceptance of the growth factors in a better way.
Thank you.
You have a question? I think you have it. Ms. Geeta? Yeah, can you unmute yourself and ask?
Sir, myself A&M in Delhi. Sir, I works in community. तो सर 2-3 चीजें पूछना चाहती थी कि मैं एक तो स्प्लिट हेयर के लिए क्या करना चाहिए और कुछ कॉम एटिकेट्स भी हैं जो हम अपनी कम्युनिटी में सबको बता सकते हैं.
लास्ट क्वेश्चन क्या था?
कॉम एटिकेट्स में कंघी कैसे करें?
कंघी कैसे करनी चाहिए? हाँ, ठीक है.
जी.
So basically, split ends do happen with dry, frizzy, dull hair, and especially hair which are treated. जैसे सैलून एक्टिविटीज करते हैं तो उनके बाद जो बालों में क्यूटिकल्स ब्रेक हो जाते हैं और क्यूटिकल्स ब्रेक होने की वजह से वो हेयर स्प्लिट होने लगते हैं. इनके लिए वो स्प्लिट एंड्स को हम जोड़ तो नहीं सकते कोई ट्रीटमेंट से, बट आपके हेयर को स्मूदन कर सकते हैं बाय यूजिंग केराटिन बेस्ड शैम्पूज और केराटिन बेस्ड ट्रीटमेंट. सो उन्हीं के पास जहाँ सैलून में जाया जाता है वहाँ पे सिस्टीन, केराटिन, नैनो बोटॉक्स, बोटॉक्स इस नाम की ट्रीटमेंट चलती हैं विच विल मेक द फ्रिजी हेयर गो बेटर एंड दे विल मेक द क्यूटिकल सेटल डाउन. बट वो किस लेवल तक दी जानी चाहिए वो आपके सैलून पर्सन को अच्छे से आना चाहिए. अगर वो ज्यादा दे दें तो और ज्यादा बाल टूट सकते हैं बिकॉज वो और ज्यादा ड्राइनेस पैदा करेंगे. सो बेटर है कि आप प्रोफेशनल्स के पास जाए जो ऑलरेडी इस चीज को जानते करना. प्लस फ्रिजीनेस के लिए देयर आर मेनी सोल्यूशन दैट आर अवेलेबल दैट कैन बी अप्लाइड ऑन रेगुलर बेसिस. देयर इज कॉस्मोफिक्स का सिल्की एएफ है, टैंगो करके एक सोल्यूशन है. सो ऑल दीज लीव ऑन सीरम्स विच आर अवेलेबल. आईमेक्सिया का हेयर मॉइस्चराइजर है. ये सारी प्रोडक्ट्स अगर आप मार्केट से या डॉक्टर से सजेशन करके लें तो आपके बालों में स्प्लिट एंड्स तो पहले होंगे नहीं, इवन इफ यू ट्रीटेड द हेयर. सेकेंडली, अगर स्प्लिट एंड्स हो गए हैं तो उसको कट करवा लें because there is no other option to make the split end stick. बाल चिपकते नहीं वापस क्योंकि ये जो बाल सर से निकले हुए हैं ये एक डेड बॉडी है. इन डेड बॉडी के साथ में कुछ खेला नहीं जा सकता. हाँ, रूट्स के साथ खेला जा सकता है, रूट्स को स्ट्रेंथन किया जा सकता है ताकि आगे चल के आपके बालों में स्प्लिट एंड्स ना बने. उसके लिए यू कैन यूज रेडेंसिल कैपेक्सिल प्रोकैपल कॉम्बिनेशन का सीरम और रेगुलर बेसिस हर रोज सुबह शाम लगाना है 1 बार 2 बार. तो उससे आपके बालों की रूट स्ट्रेंथन होगी और वो स्प्लिट एंड्स नहीं होंगे. आपका सेकंड क्वेश्चन है कोम करना. आप वाइड एंगल कोम यूज कर सकते हैं अगर आपके बाल बहुत थिक हैं और बहुत ज्यादा कर्वी और वेवी और कर्ली हैं. अगर आपके बाल सीधे हैं, स्ट्रेट है, नॉर्मल है बिल्कुल और ज्यादा डेंसिटी भी नहीं है, एवरेज डेंसिटी है, तो पैडल ब्रश इज द फाइनेस्ट वे टू ब्रश योर हेयर. क्योंकि पैडल ब्रश जब सर पे लगता है तो उसके अंदर का जो वैक्यूम बनता है हल्का सा, वो आपके बालों को लिफ्ट भी करता है और आपके बालों में एक हल्का सा स्टिमुलेशन पैदा करता है. सो इट इज गुड फॉर स्टिमुलेटिंग द सर्कुलेशन ऑफ द हेयर. सो पैडल ब्रश दिन में 2 बार करना बहुत अच्छा है. और जिन लोगों का ऑफकोर्स बाल बहुत ज्यादा कर्ली है और मूवमेंट नहीं कर सकते बालों में ज्यादा, वो पैडल ब्रश तो फंस जाएगा. तो वाइड एंगल कोम से स्किन के नीचे रख के स्किन को भी आपको मूवमेंट देनी है. तो स्कैल्प स्किन स्टिमुलेशन दिन में 2 बार करना बहुत जरूरी है.
थैंक यू सर.
थैंक यू.
So, Dr. Agrawal, there's a question on the Facebook which says, if I go for a transplant, I heard that the life of the transplant here is about 2 years.
About?
And it's about 2 years, he says. It's about 2 years. He says that he has a past experience where he knows somebody who lost his hairs within 2 years, and it's an expensive procedure. Do you think it's worth it? And what is the reality on it?
No, so I'll give you the reality check. I have traveled the whole of India. I have worked with many doctors. When I came back to India in 2009, after having trained in the US with New Heart Hair Transplant Clinic, I've done more than around 400 surgeries in the US. And when I came to Dubai for 9 months, I practiced more than around 700 cases plus. It's about the expertise. It's only about the expertise of the surgeon, of the doctor, of the person who's planting the hair, at what depth they leave the hair, and how they angulate the hair so that the hooking of the hair happens. Remember, the hair on the scalp skin is growing down. Okay? This hooking has to happen with the kind of slit that you create. So if the hair is left like this, the hair is halfway up, it's going to fall within a year. If the hair is left like this, it's going to fall within 2 years. If the hair is left like this, see this depth, okay, inside the skin, the hair is not going to fall for the 15 years. There has been a study of excellent doctors in Korea with 30 years of check on more than 10,000 operated hair transplant patient. They checked when did they start losing their hair. In the best of the best hands, with a good surgeon who's operated, they selected about 15 surgeons and all their surgeons' history were taken. Their long standing of 30 years of those patients' history was taken. They found out that 15 years later, every 5 years, the patient lost 15 to 20% of his planted hair every 5 years. So this is reality check. So when somebody promises you, I'll give you hair for life, do not believe this. Somebody promises you that your hair once planted, they are with you for life without doing anything. No medicines, no treatment programs, no anything, lifestyle changes, no food, medicine, nothing. He is not telling you the truth. He's just trying to lure you so that the maximum amount that he can take at the first time. Remember, every year you're investing on your hair minimum from 30,000 to up to 80,000, maybe a lakh full also, depending on if you're doing low light laser therapy, you have a device, plus you might have to buy a device every 5 years, plus you're doing growth factor injection every 2 to 3 months, you're doing PRP injections if in case you want every month, or you're doing nutritive cyclical therapy. All this has a cost. So minimum costing that I have worked is about 3,000 rupees a month. So looking at 36,000, 30,000 minimum in a year's time that you're spending is what is going to go throughout till you want good hair. So you must decide that if you do a transplant, you might want to do a second transplant about 10 to 12 years, 15 years later. But if you're not able to take the right medicines and maintain those transplanted hair with their existing hair, the hair over hair is what is to be created so that the scalp skin is not visible. So remember, every transplant doesn't come with the idea of doing only one transplant. Every transplant comes with the idea of doing 2 to 3 more transplants, which no doctor speaks. They say, एक transplant में आपको हम बहुत अच्छा गजब result दे देंगे, which is such a lie. But when you tell them the truth, you may be doing less numbers and you may charge high, but still you will have successful results. In my life, I've got 2 unsuccessful results. I'll tell you why. Those patients were very enthusiastic. They wanted a lot of grafts. They said, doctor, take hair from my beard, my chest, my underarms, my privates, my everywhere. I did about 16,000 grafts in a patient with 3 days of surgery, but 50% of the hair grew. Of course, he was like a trauma that remained with me for 8 years. But had I not been very enthusiastic, had I given him the explanation that this is what we do now, we wait and then we watch and then we do later, and add in between them, this is what is the final take, that you have to keep patience. Do not go by the word of the doctor or the word of the patient, because the patient wants a lot. And sometimes the patient also demands very low hairlines, very crooked looking hairline, which is not right. So you give them, which is standard, a very natural looking hairline with softness in the front. And as you keep going back with more thickness. So the more natural that you keep, the more natural design that you give, and the least that you want to do and give is the best. The more you try to do, everything is more about today's time. Today, sab kuch zyada chahiye. If excessive, everybody wants more. So I tell people, don't go for excessive stuff. Go for very limited, which is right. And let that grow. And then in between, add them. Hairline, typically, 70% to 80% people want to add in between them. Especially my models and my media personals who come to Bombay, because Bombay, it's a world of media people. So they want a very good, thick hairline. And hence, I always tell them, you might have to come for a density session. You might have to come back again after a year or 2. But that's not that he's lost transplanted hair. It's his own existing hair is thicker compared to his hairline, which is planted, and hence we need to add more volume. So when you plant, you can go maximum about 0.8 difference between the hair. But unfortunately, if you actually see a normal human being, in about 1 mm, they had about 3 hair. So the difference between 2 hair is hardly about 0.3 mm. So that close a surgeon cannot plant. Nothing will grow. So if you have at the right place, at the right doctor's clinic, at the right people doing work for you, you will not have this issue.
At what age group? You talked about like 21 is the age where people should start.
Internationally, 22 is the age that you should start doing a transplant if required. Because remember, patients sometimes are very progressive in losing hair. Now they have lost a little, but they lose the rest also. So to avoid that phase, they must first be given medicines. They must be first given application. They must be first given. So you have to make them wait till there is a stability. The hair fall has become stable. And that will happen typically after 2 to 3 years or 4 years time. After treatment. Normally treatment doesn't give you immediate stability. So once the stability is there and you've seen that the hair is not falling any further for more than a year, then you can think of doing a transplant just to build that area. But remember, he will still lose the remaining area. So what God has told us that from here till all the way here, when you feel a little bump here, there's an occipital zone where you feel a bump. Just a finger above that bump and 3 fingers below that bump. You will not lose hair. But till that bump, you will lose all this hair eventually. That is called as androgenetic alopecia.
What should be the gap between the 2 surgeries?
So yeah, again, it depends on the surgeon. It depends on his expertise. If he's seen the hair growth, which is good and happening in about 6 months' time, we can take the second surgery. Or rather, I would ask them, always wait for more than a year, 12 months to 15 months, so that every hair is grown back. Even if the redundant, dormant hair, the hair which is not grown yet, they also start to grow back.
And does your surgery, like the effects, like do you ask questions related to hormone issues or clinical issues or mental health or the sleep pattern or something? Does it affect?
So yeah, when the patient comes in for a consultation, there's a questionnaire which starts saying that, are you losing hair? Then the patient says, no, not now. I lost a lot of hair already. Or somebody says, no, I'm still losing hair. Yes, of course. Then second question comes is, who in the family has lost hair? Is it genetic? You think. They may think, they may not think. They say, no, this is not genetic. I don't know, anybody's not lost hair. But then we probe into the question saying that, is your maternal uncle's lost hair? Has your maternal grandfather lost hair? Somewhere in the fourth generation in the life, you will have lost hair somewhere, somebody. Then third question comes, have you had a hair transplant consultation or a restoration consultation? They may say yes, no, depending on what they've gone and where and how. If they say yes, what was the suggestion there? So then we can always evaluate that why he had to change his mind to come to us. And then similarly, the questions go on medical, where we ask them, how's your mental health? How's your neck strength? How's your spine? How's your concentration power? How is your sleep patterns? How is your regular habit of cleaning your scalp? Some people say, I clean with soap. I said, no, you have to use a shampoo, a transparent shampoo, which will just cleanse, a cream-based shampoo that will hydrate and strengthen the hair. So many questions that will come in as a point where medical questions have to be asked, where they have any blood pressure, diabetes, asthma, had any in the last 2 years, typhoid, jaundice, malaria, admission in the hospital, any surgeries done in the past. All these many medical questions have to be asked. And these questions,
there are added question in it that if somebody is still losing their hair, how successful is the surgery?
So now again, as I said to you, if they say actively losing hair and I will do a hair pull test and I will find out, I will tell them, I would wish to wait for 6 months till your hair stabilizes. The hair fall stabilizes. My treatment plan will give you all of it. But they say, no, we have no time to wait. I have a flight to Australia after 2 weeks and I'll be working there for the next 2 years. I'm not going to come back to you, doctor. I said, you have to promise me 2 things. You have to take this medicine, which I'm going to give you for a week. Cleanse your scalp well using beta scrubs, povidone iodine, and things like that so that there is no inflammation. Also give them anti-inflammatories like a mild steroid to apply on the scalp so that the action is a little faster. But I'm not promising him that his other hair will not fall from where I have planted. So I will demarcate and mark and show him that this is the area that I'm planting. And if you have these hair grown in, but the back hair falls off, I'm not responsible for that because you didn't continue my medications. But if you promise me the next 2 years continuously you'll take medicines, and after 2 years also when you come back, you follow with me, and I might continue something more with you. Is that what you're willing? I will do something for you. If you're not willing for that also, I think you have many doctors around who are ready to do fake work for you, which is going to be bad for you. Eventually you can choose them also. But I will always have a successful transplant because my counseling is not just once, before surgery, after surgery, and after third day when they come back. So I counsel them 4 times. Same questions, same things I've asked and explain again and again.
Sir, is there any AEFI reported?
I didn't get you. Coming area?
Sir, adverse events following implants. Sir, koi aisa hua?
Yeah.
Sir, I have heard in community.
Yeah. So basically, hair transplant can cause a lot of during surgery, after surgery, and maybe much later after surgery. So during surgery, what happens? Sometimes patient goes vasovagal attack. You've given anesthesia, and sometimes the vagus nerve, which is there in the scalp, can also, especially the back area, get stimulated, and the patient feels fainting. So you have to be proactive. You have to keep talking to the patient, ask him about his breathing, ask him about how he's feeling. And if there's anything that you see as signs, you have to always keep a monitor, a pulse oximeter with a blood pressure monitor. All this has to be monitored regularly while the anesthesia has been given, and almost for 20 to 30 minutes after anesthesia also. So that is about anesthesia complication. Suddenly, sometimes when you're doing a lot of transplant graft and the patient wants a lot of density, you might go very close to the hair. And as I said, the 0.8 mm gap is reduced to 0.6 and 0.4. So a lot of tight packing that can cause necrosis of the skin, and in delayed time, you'll see a patch of skin lost from where the hair was planted. Of course, there are people who have other issues on the scalp skin, which is reaction to anesthesia or some kind of pus formation, which is a pre-diabetic case where they'll have multiple pustules forming all over where the hair is planted and removed from. So many such things that can happen. So pre-evaluation, which is major. Secondly, complications for anesthesia, which is to be checked. If they're taken anesthesia before, fantastic. If they're not taken before, call them 24 hours before in your clinic. Give them a shot of anesthesia test dose and then see what is happening. Of course, the patient sometimes doesn't come that way. I'll come on the day of surgery and you have to start operating. No, he has to wait for 20 minutes before some reaction happens. Quick reaction can be seen within 20 minutes. So you have to give the test dose, wait for 20 minutes. If there's any reaction to anesthesia, of course, do not do surgery. But if there is no reaction, of course, you can continue forward, because today's time anesthesia is very safe. There is preservative-free anesthesia available. There is a lot of solution which are available that can control that losses and problem. You can start off with the surgery with an antihistaminic and a mild steroid injectables if the patient had past history of something like a lot of swelling after any kind of procedure. So a lot of pre-counseling, pre-preparation that can help prevent the complications.
Right. So we'll take the last question. The chat box, Ms. Angelique Korji has asked from South Africa, will all of these herbal products be in the lotion or would it be taken orally? That's one question. And the another question, which is my question, is, has anybody lost life ever in this surgery? Because there was a lot of rumors which came in between. So I think these two questions are with which will end the session, I would say.
Yeah. So taking up the first question, I think, thank you for asking this question. This was one of my favorite topics to decide that when I started doing transplant in 2009, I had only minoxidil that I could prescribe my patients. In 2012 and 13, we had certain other new products that were added for the growth of the hair. So adenosine triphosphate came first, following with Regenerative in 2014. Capexil combination with Procapil started coming with minoxidil. Caffeine came into problem. All these are lotions and potions that can actually help grow hair, and that can happen. So definitely all these, what I talked about, everything is available as applications. And the more you apply, remember, hair grows on your skin every 4 hours. That's the beauty. You don't even realize. बाल उग रहे हैं, and वो ऐसे उग रहे हैं जो बहुत ही कम distance पे. So if you see in a week's time, they would grow about 3 millimeters. In about 2 weeks' time, about 6 to 8 millimeters. For people who have very high growth, maybe up to 1.5 centimeter also. जो लोग बोलते हैं हर 2 हफ्ते में बाल कटाने पड़ते हैं, probably उनका वो एक उंगली बाल बढ़ जाता है. That is about 1.5 centimeter. That's why they want to go and cut their hair again. Some people say नहीं महीने भर तक भी हमको कटाने की जरूरत नहीं पड़ती, doctor, it's too late. So their growth is only very slow and redundant. So all these applications, right from adenosine to Regenerative Capexil, they will prolong the anagen growing phase and hence grow the hair longer and faster. So all these applications are available today's times on different medications, different combinations with different companies, but they can actually enhance the growth and make the hair grow faster. Of course, if you can apply every 4 hours, your growth will be super fast. But of course, nobody has the time and the energy for this. So I tell them morning, evening, 2 times application and you're good to go. Talking of your second question, there have been 8 deaths last year. It's a sad story. It's a sad topic that we're discussing. ISHRS decided to come as black marketeers who are actually doing surgeries without any degree, any certifications, any experience, done by technicians and people who are not qualified for doing surgeries. They said, we will fight this back as a battle. We'll stop those centers, those clinics, those places where deaths are sure to happen. Remember, asepsis is the first important thing. What do you mean by that? Sterility, the sterile room, using autoclave, all the instrument, material, products that are used on the patient, right from cleansing the patient to make him absolutely clean, so that no infection spreads anywhere. All this care has to be taken, and only a knowledgeable person with a medical degree, an operating OT nurse who's certified, have the qualification for doing this. So all these places where this was not seen, of course, some cases which were a little difficult where there was more to that, and that was the anesthesia complication. Again, we don't know the delayed reaction to anesthesia. Now, frankly, if I tell you how many deaths do happen when a patient goes to a dental doctor, the dentist puts an injection and the patient says, "Mujhe theek nahi lag raha hai." He goes out, he just collapses and he's gone. Or he goes out to another hospital because he's not feeling good, he's breathless. The hospital says, "Kya hua tha?" I went to a dentist, they gave me an anesthesia injection. And then they have admitted in the hospital, the patient goes into coma and is gone. 1 in 10,000. In a dental chair, a patient dies. We don't know this.
What deaths are happening is because of the anesthesia and not because of the procedure.
No, so again, there are two ways. I first told you about the procedure. Who should do, where you should do, how is the condition in which the procedure should be done to avoid all the other risks and complications. Second is the anesthesia. So these are the two major reasons they found out in the last 8 cases, which happened to be death because of anesthesia, because of other reasons also. So I tell you, it is not, sometimes the doctor is very experienced. I know somebody personally also. Well experienced, knows everything, does surgery for the last 10 years. And suddenly the patient collapses. Unfortunately, in this clinic, he was not prepared with the emergency like such. ACLS, advanced cardiac life support, AMBU bag, laryngoscope ET tube, drugs like atropine, adrenaline, F-colin, everything. Having to give good CPR, having to know how to rule out if the patient is now going to be stable or no, an ECG monitor, a BP monitor, a complete system. So of course, NMC is now coming with rules in which they say, if you have to be attached with a local hospital, if you're doing a surgery, or your hospital or a clinic should be equipped with everything such like an ICU setup, so that you can save the patient if anything complication happens. See, complications can happen. You cannot deny complications, but you need to act on your complication. And if that is where you're lacking somewhere, years of experience also do not count.
Absolutely. I think we don't have any more questions on the floor, and I think we are already over time.
Thank you so
I
much.
think it was a very exciting and a long-standing topic, which can go on and on and on. Which obviously I think you were right. This can go over for weeks and all. A lot of questions are there. We can have a follow-up session as well in this if it's required. But with this note, if anybody has any other questions, otherwise we'll close the session and we'll say thank you to Dr. Agrawal for enlightening us with this immense knowledge. Thank you so much, and we'll see you again.
Thank you so much. It is such a pleasure. And I'm sure I'll be able to satisfy everybody with their questions and answers, and looking forward to see you all in Mumbai sometime.
Thank you, sir.
Sure.
Please do come.
Thank you.
Thank you.
Thank you again. Thank you.